A new health alert is making waves globally, as the World Health Organization urges countries to brace for a possible increase in hantavirus cases. This virus, while less known than other global health threats, has deadly potential, as evidenced by the outbreak on board the MV Hantavirus cruise ship. With 3 confirmed fatalities and multiple cases of severe illness, including a French woman now on life support, the spotlight is firmly on the Andes strain of hantavirus. But why should the world pay attention now, and what does this mean for our global health systems? Hantavirus is usually transmitted to humans through contact with rodent excreta. However, in rare cases, like this outbreak, person-to-person transmission can occur. The MV Hantavirus became a vector for the virus as it sailed from Argentina to Cape Verde, with passengers interacting closely before the first case was detected. The ship's plight highlights a critical gap in how global health crises can unfold in confined, international settings, with devastating consequences. This outbreak isn't just a health issue, it's a geopolitical case study in solidarity and its absence. Cape Verde's refusal to let the ship dock contrasts sharply with Spain's decision to allow an evacuation in Tenerife, despite internal political disputes. Spain's central government overruled objections from the Canary Islands regional authorities, illustrating how decisive leadership can save lives, even amidst local pushback. The Spanish government's handling of this crisis, praised by the WHO, underscores the importance of prioritizing humanitarian action over political calculation. But the question remains: how many nations are willing, or prepared, to do the same? The outbreak also raises deeper questions about global health preparedness. Unlike more familiar viruses, hantavirus outbreaks are relatively rare and localized, which can lead to complacency. But as this episode shows, the long incubation period and potential for severe respiratory complications demand proactive measures. The WHO's recommendations for a 42-day quarantine and rigorous monitoring of high-risk contacts are critical steps, but they require global cooperation, resources, and public trust, qualities often in short supply. Historically, pandemics have revealed the fragility of the international health system. From the SARS outbreak in 2003 to COVID-19, delayed responses and insufficient coordination have repeatedly amplified crises. The MV Hantavirus incident is a microcosm of these challenges. It's a reminder that diseases do not respect borders, and global health requires a rules-based approach where nations share data, resources, and expertise transparently. One cannot ignore the risk of misinformation in such scenarios. Disinformation campaigns, whether deliberate or born from panic, can undermine containment efforts. During COVID-19, we saw how false narratives spread faster than the virus itself, creating divisions and eroding trust in public health measures. The hantavirus crisis presents a similar risk, especially if states or actors attempt to downplay their role in containing the spread or shift blame onto others. The world is at a crossroads. Will we learn from past failures and strengthen our collective response mechanisms, or will we allow fragmentation to define our approach to emerging health threats? As the passengers of the MV Hantavirus face long quarantines and uncertain recoveries, they serve as a stark reminder that global health security is only as strong as the weakest link. The time to act is now, not just to contain the virus, but to build the resilience needed to face the next crisis head-on.